Good evening. I'm Sarah Loudon from Total Health Conferencing, and welcome to another episode of inspirED. Tonight, I'm joined by really an inspiring panel in honor of Breast Cancer Awareness Month. And we're going to talk about just a number of things, from how all of these people got into what they're doing to what they feel the impact is in the breast cancer space. And certainly it'll be a time where we can kind of talk about where we are, where we're going, what we hope to be accomplishing in this very uncertain time, walking through COVID-19. So I'm going to start with just very brief introductions of everyone on the panel tonight. We're joined by Dr. Cynthia Lynch, medical oncologist from Cancer Treatment Centers of America, Nurse Colleen Brennan-Doran, breast oncology nurse from Sylvester Comprehensive Cancer Center of the University of Miami, Alison Banikowski, a patient advocate supporting Susan G. Komen and KU Cancer Center, and Valerie Mitchell, both patient and patient advocate. I'll ask each one of them to give a little bit more detail about who they are and what they do before we jump into some of the interview questions. Dr. Lynch, I'm going to start with you. Can you tell us a little about you, your practice, if you kind of mostly see breast cancer patients, and where you're located?
Yeah, so as you mentioned, I'm Dr. Cynthia Lynch with Cancer Treatment Centers of America in Phoenix, or right outside of Phoenix in Goodyear, Arizona. And yes, I'm a medical oncologist, and my focus of my practice is almost exclusively breast cancer care. And it has been so, since I finished fellowship many years ago. And so, for those who aren't really familiar with what medical oncology does, I would say we're kind of the general practitioners of cancer care in part, but also we manage a lot of the treatments as far as if there is chemotherapy involved or endocrine therapy, hormonal options. We do a lot of the long-term follow-up of women with breast cancer as well. Also, we see patients who we have discussions about high risk. Patients who maybe don't have a diagnosis themselves, but are considered high risk, and we talk about risk reduction therapies as well.
Okay, thank you so much, Doug. I'm sure that we'll have a kind of a robust discussion about what you do and generalize it for the audience as we go forward. Nurse Colleen, can you tell us a little bit more about you, kind of what you do day to day, and then where you are in the cancer center?
Sure, Sarah. Thanks for inviting me. I've been a nurse for 30 years and the last 20 in oncology. I've had the pleasure to work at the University of Miami in the breast care clinic with Dr. Charles Vogel, one of the most well-known breast cancer doctors throughout the country and if not the world. I'm lucky to be with him for the last 14 years. The last 10, I've been his primary nurse in his breast cancer clinic. My job consists of triaging patients, getting the clinic ready, educating patients and families, and anticipating the needs of the patients, particularly. Our responsibilities have grown so much just in the last 10 years, mainly because of oral chemotherapies that have exploded. And it's not just AC, as they say, adriamycin, cytoxin, followed by Taxol. Now we just have so much more to teach our patients, and choices are tremendous. So I spend a lot of time on the phone with patients and in clinic. We have almost 800 patients who are currently being seen in our clinic. Not all at once, thank God, but we're very busy. And even with COVID, our patients are coming in. A little delayed, but they are coming in to see us for their follow-ups.
Thank you. Colleen, I think, you touched on so many things that we'll get into in tonight's interview. And I think one of the most important things that resonates so much with me, and I'm sure with the audience, is the nurse's role in kind of meeting the needs of the patient. So that's not just clinically, following the direction of the medical oncologist, but it's really getting to understand how the patient is doing throughout the journey with treatment, which I think is such an important aspect of kind of that treatment continuum. And I think nurses play probably one of the most vital roles in terms of patient care. So thank you for that, and we'll get more into how that works as we go on. Alison, we've had the pleasure of working with Susan G. Komen, and I don't know that there's really anyone in the United States that's not familiar with the banner that the Komen organization carries, especially as it relates to being that voice, that unified voice and advocate for breast cancer. Maybe you can tell us a little bit about what you do and how your work incorporates both Komen and a cancer center in Kansas.
Yes, thank you, Sarah, and thank you for inviting me. I actually am a fundraiser with Susan G. Komen, so I'm not associated with the organization other than the fact that I'm a champion of the Susan G. Komen organization. 10 years ago, when I was diagnosed with breast cancer, I felt like I needed to get involved, and I donated, but I'd never done anything active-wise. So I formed a team. And so 10 years later, I'm still involved with Susan G. Komen fundraise for them. We happen to be the top fundraiser team in the Kansas City area. So that's for the last 10 years. So we're quite excited about that. And more than anything, it's an opportunity for people to get involved in important work that Susan G. Komen does. I also, because I had my treatment at the KU Cancer Center when I had chemo and radiation and surgery and all that, I have kind of hooked up with the KU Cancer Center. I do also provide some funding for them, as well as I've joined a group called Pivot. And that is I don't remember what Pivot stands for, but we are a group of individuals who work with researchers. So to give the patient view, for example, I just had an opportunity to read some grants that were submitted and to evaluate some grants from a layperson's perspective. So I'm really kind of peripheral to these organizations in a sense. I'm not one of their staff members, but I'm kind of a champion, being a breast cancer survivor, and I'm a lifelong educator. So it's important to me to do a lot of those opportunities for giving back, as well as to helping other people be aware of what is both breast health and breast cancer.
Thank you so much. And there are so many stories where advocates really started when they were given a diagnosis and kind of went through it. So I wouldn't say that you're peripheral. I would say you're vital to organizations like Cancer Center. So thank you for what you and your teams are doing. And then Valerie, I've had the pleasure of getting to know you and hearing your story on a previous project that we did together, and I just think that you're fantastic. I'd love for you to share a little bit about you with our viewers so that they kind of get to understand where you're coming from.
Thank you so much for inviting me to be a part of this project also. And my name is Valerie Mitchell, and I am a 4-year cancer survivor. I was diagnosed with breast cancer April 15th, tax day in 2016, and I'm celebrating the official cancer-free diagnosis October 6th of this year. It'll be 4 years. So I'm really excited to be here at this stage in the recovery. And with that, I've been able to partner with an organization called Here for the Girls that is a support group for younger women diagnosed with breast cancer. Which that's really given a lot of support to me and allows me to also connect with other women who are newly diagnosed. And I also work as a peer mentor and patient speaker for Neuralinks, which is a newly FDA approved medication that can be really scary for a lot of women. They hear about the side effects. And so I like to share my experience with them, just letting them know that it's manageable, it's doable. And then my day job, I'm a licensed professional counselor.
Thank you. Yeah, I find your story to be so empowering, and I stand with you to celebrate that October 6th. No evidence of disease. So I'm so grateful for that. Okay, so, this podcast really is about breast cancer awareness, and, so much of, I've had the pleasure of working with Lily Shockney, who most of you may have worked with or heard of. And she's really a champion, mostly in the metastatic cancer space, but just a champion for breast cancer in general. And one of the things that I think is so important when we talk about breast cancer and October and pink and all the other things that kind of October's really come to be known for, largely because of Komen and its efforts, I think it's always so important to make sure that we're shouting out to people who are early stage and people who are metastatic. They're two very different groups of patients living with, beyond, and in many cases, advocating for breast cancer. And I think it's so important that everyone feels included because, they all kind of carry that banner of being a patient who has heard the diagnosis of breast cancer, but have had very different journeys from that point of diagnosis. So I want to make sure that all throughout tonight, we kind of talk to both audiences so that, both kind of feel included, heard, seen as we go forward. So Dr. Lynch, I'm going to come back to you and kind of just ask you, what Breast Cancer Awareness Month means to you. And if, you were sitting next to someone from another planet that just dropped in pink month, what would you say this month means, and really what it means both to people like you who've given your life to the treatment of breast cancer, as well as people who are living with and beyond breast cancer?
Yeah, so I think of it has so many different dimensions this month when you think about breast cancer awareness. I think you said very well, the idea that it means different things to different people. For some individuals, it's a new diagnosis. For some people, it's not even really being aware of what their risks are or who needs to undergo screening. So I think it really does. It's a month to try to shine the light on breast cancer. Unfortunately affects so many women. 1 out of 9 in their lifetime will deal with breast cancer. So almost every family, have had either, there's someone in it who has personally been touched with it, or a relative very near to them has been touched by breast cancer. So I think for those who are not diagnosed, it's a time to remind women and to really get that message out of how important it is to undergo screening, and also for women to be aware of their breasts, to report early on any symptoms. So I think sometimes people don't really know what that means, or they feel like if they don't have a family history that they're not at risk. I can't tell you how many times I have patients who came in and said they were just shocked that they were diagnosed because they didn't have someone in their family with that diagnosis. And I say, highest risk factor is being a woman, and as you age, those are the 2 greatest risk factors, and you can't escape either one of those. So it's really important, I think, for those who are unaware of what the symptoms and signs and symptoms are of breast cancer, to be aware of those changes and to know where to go to report that. I think, that varies in different states and locations as to who you can go to, but there's always resources at you can always go to your local hospital. Komen is a great one, American Cancer Society. There's lots of resources out there for women who may not know where to turn, who may have discovered an abnormality in their breast, but just don't know who to talk to. So there's I think it's important to make women aware of that. Also, it's a time when I think of, because there's such a reflection on women with breast cancer, there's so many needs, the women who are undergoing treatment, and maybe it's, a brief period of their time where they're undergoing treatment, but they may need assistance in, transportation. And, I think of American Cancer Society, where their Road to Recovery, where they provide transportation. So I think it's important for women who are undergoing breast cancer treatments, who may feel alone and frightened and not aware of all the resources that they do have, just to bring that to light during this month as to all the people and groups that are out there who really want to, wrap their arms around these women and support them during this time. And then you think of women who are beyond their treatment, but who are still struggling with surviving that diagnosis of breast cancer and living beyond that. Many women who will have ongoing symptoms, maybe related to treatments that they've had, or even just body image changes. So I think of those women who are, living beyond cancer, but still dealing with those symptoms and side effects. And sometimes that's a difficult place to be. You think of, there's a lot of emphasis put on other areas of breast cancer care, but for some women, that's a very difficult time. It's almost like when they're going through treatment, it's just one thing after the other. It's so fast paced. It's sometimes hard to stop and think about and process everything they've just been through. And so sometimes it's that period after treatment where there's a lot of support that's needed, both physically and emotionally for women. And then, as you mentioned, women who, continue to live with cancer. So women who may have stage 4, or the other term that we use is metastatic breast cancer, where it's kind of, I would say we look at it more as a chronic disease, where it's that ongoing treatment that they require, and looking at supports for them. So I'm a huge proponent of research. That's always been a big part of my, entire career. And so I think shining light on those areas too, and so I think, this month kind of reminds everyone and makes everyone think about breast cancer, but there's so many ways for people to get involved, and at so many time points throughout, prior to diagnosis and even beyond.
Yeah, I think that's so, I love the way you kind of not just called out that it is multidimensional, but really gave such good examples of how that's multidimensional. And, any diagnosis is very isolating. You get the diagnosis, everything turns upside down. And Doc, like you said, you're almost like right away in, okay, tell me what to do mode. And you're not really processing that what to do emotionally. You're just going through the physical steps, step by step. Nurse Colleen, I want to kind of pivot to you a little bit and say, during this time of COVID, patients that, whether you're coming in for metastatic treatment or early stage treatment, a lot of times you're coming in alone, or you're alone, during, maybe someone's there with you, but they've got to wait in the car, or wait in a patient waiting area, a guest waiting area, or, a place where traditionally, I think to all of us on this podcast tonight has felt like, okay, well, at least I've got my best girlfriend or my sister or my mom or my husband or whoever my greatest support is while I sit here through this very scary drip that's happening, or, this long visit that's reviewing scans or whatever it might be. Do you feel that the role of the nurse and the rest of the support staff has changed since COVID, where you all almost stand in as those, caregivers, loved ones, et cetera, while people are going through this very scary time?
Very true, Sarah. Think about a year ago, how many of us even thought about telemedicine? Mm-hmm. Now, Zoom calls and telemedicine is, in the beginning of COVID, it was half of what we did. Some clinics, it's all what they do, and ours is about a quarter now. But the number one call I get is from patients saying, is it safe for me to come in? Yeah. So we have 3-month follow-ups, 6-month follow-up, yearly follow-ups. They need their mammograms, their ultrasounds, they need their bone density studies. I'm talking early stage cancer now. And I tell them, yes, our facility has adapted to COVID. I tell them what we've done to keep it safe for them to come and how important it is. Many of them in the beginning, April, May, and June, did delay coming in. And, but we've since encouraged people to show up, and they have. I'm very grateful for our patients that they need to be screened for relapse. They need to be screened for wellness, long-term side effects of chemotherapy, neuropathies, cardiac, what the hormonal treatments can do to their lifestyles and change them, how we can help take care of them through those issues that are ongoing and lifetime, and the anxiety of breast cancer in itself, plus the anxiety of relapse. But our patients are slowly but surely coming in. Stage 4 people have never had a chance to stay home. They had to come in. And it was difficult to come in without a loved one, without a mother, a sister, a friend. We had the phones, we had the telemedicine, FaceTime with the physician. They couldn't bring their animals in anymore either. I mean, it was never ending. And then wait where you're safe. They sat in the parking lot, we called them in, we had to screen them. people who came to the infusion room for the first time had COVID testing, whether they were exposed or not. Imagine if you've been doing all the right things for COVID and they say, well, before you come in to get your treatment, we need to test you. That adds more anxiety. But people are adapting. They had to.
Yeah, and that really is such a great word. I think, when you think about patients who have been diagnosed with breast cancer, words that come to my mind are words like, adaptable, resilient, brave, vulnerable. Those are really things that you kind of picture when you picture these people who are working through. And so, I definitely, it's been such a time. This has been such a time, and it has added on top of the things that we, typically have seen patients experience. It has added so much to it in terms of isolation and loneliness.
But as you know, our breast cancer survivors and patients are very strong women.
Yes.
And when they have support of their family, their loved ones, when they have the power of prayer, when they believe in themselves, they can do it. And the nurse and the doctor and the staff can really make a difference in how they are able to adapt.
Yeah, you stand in as their family, which I think is really incredible. Thank you, Nurse Colleen. Thank you for that insight. Alison, we talked about your role and the role of your team and teams like yours in supporting bigger organizations and kind of meeting their own goals. Advocacy has changed so much, and I feel that since COVID, advocacy has gotten even a greater place at the table. Before it was kind of like there was the medical community and then there was the advocacy community, and they very rarely communicated. And now through COVID, it's almost like there's been a spotlight on the need for advocates to fill in where the medical community cannot reach patients in this time. So I want you to, to kind of walk us through, both from a personal perspective of you being someone who's kind of walked this walk, and also how it's become a passion for you and how your teams work in identifying or creating your own goals and then matching those, or if that's the process, maybe you're given goals, and then what you think the power of advocacy is and how you see it continuing on even past this hopeful COVID-19 season of life.
I think advocate organizations play an extremely important role in the cancer journey. And I don't think I would have ever thought that even when I was going through it. The advocacy groups, and in my case with Susan G. Komen, they provided that sisterhood, that role models. Oh my gosh, there were so many people. I'm like, oh my gosh, well, this is very doable. This is possible, because, oh my gosh, that woman is a 25-year survivor. So I get an opportunity to connect with individuals that made it hopeful for me. I think the other role that advocacy organizations helped for me was it helped me to look beyond myself. Oh my gosh, yes, I have stage 2, but oh my gosh, this woman has metastatic breast cancer and she's dealing with a whole nother set of issues. And that I became aware of people beyond myself. Certainly I was going through something, but gosh, I really developed an attitude of gratitude, if you will, going through this journey. And that was partially because of advocacy organizations that I helped to get connected with, and to say, oh my gosh, we could do this. We have women that don't have insurance. I had great insurance. We have individuals who need help with transportation, or they need help with their daily living. And advocacy organizations can help fill that financial gap. So I think advocacy organizations, and probably during COVID, even more than anything, because people are looking out there for answers, and they don't always, I had a lot of people at work when I was diagnosed with breast cancer that were breast cancer survivors. So I could go and say, okay, what are you going to tell me? What did you do? What was your journey? How did you decide to have this kind of surgery or that kind? Well, gosh, now most people are home by themselves, or with their family that may not have that information. You can connect with an advocacy organization and the American Cancer Society, Komen. They can connect you with information and sometimes with people that you might not be able to connect with when you're home during this strange time that we're going through right now with the pandemic.
And Alison, do you find that for you and your team, it was like dig in deeper or dig in stronger when all of this happened? Did you kind of feel that, okay, girls, let's kind of get to work even more?
You know, it's kind of interesting. I really didn't feel that this year we would raise very much money just because, gosh, there's so many needs out there from, food. People need food. So I was kind of surprised. I only set a goal of 5,000 this year, and we're over 14,000 now. And more money seems to be coming in every day. So it's like people want to give. Sometimes it's just asking people, and people have been very, very generous. So we've been fortunate. I mean, we're just a small little team trying to do a little bit of our part. But I think during this time, it's been interesting. People have really stepped out and really are trying to help meet a need because, as we keep saying, cancer didn't stop just because we got COVID in our world. It's still there.
For sure. Well, again, I can't say, how grateful the whole community is that there are people like you and your team and others that just kind of stepped up when the need arose. So I appreciate everything that you do for this. And Valerie, that kind of dovetails a little bit what Alison was saying in terms of, the personal connection with advocacy. So here you are, you're diagnosed, you may or may not have that community of people that that have had cancer before. And if you're young, sometimes it's like, well, this is, as Doc was saying, it's a woman's disease, and it's like as you get older. But here we've got this population of women who are diagnosed young. And all of a sudden it's like, wait, I still have toddlers. I, just got this job. I am 5 years into marriage, or, it's like all these things that's like cancer was not supposed to be in this book chapter. It was, if it ever was going to come, it was supposed to be closer to the end. So, with organizations like Here for the Girls and just with your own story, how does one deal with that? And where's the right places to go?
I was surprised to get my diagnosis. I never really thought of myself as getting breast cancer because it wasn't something that ran in my family, and I didn't know very many people with it. And so it's not one of the diseases I ever actually imagined. And I was naive as well. I did not know how frequently breast cancer occurred. So when I felt the lump in my armpit, and I was good about getting mammograms and all of those things, and I had a mammogram in that January, but then a few months later, I felt a pretty sizable lump in my armpit, which was connected to a 2-centimeter tumor in my breast. And one of the first calls I made was to a colleague who had gone through breast cancer treatment a few years before me. And she was really great in connecting me right away. She said, I will answer all of your questions about the business side of things and what I did. But she said, let me tell you first about Here for the Girls. And so I really was very fortunate to get connected with them right away and saw the full range of women, met, 10, 15, 20-year survivors, as well as meeting women with metastatic cancer and inflammatory breast cancer, which I knew nothing about. As well. I didn't even know that was a thing. So it had helped to understand what was it on the road ahead of me. And that was just really, really invaluable to have Pink Sisters walk that journey and be there. They really knew what it was that I was facing, or what I was about to face. And so they were just a terrific line of support for that.
And for you personally, were you kind of in that same mental place of, okay, I have my diagnosis, here's kind of like my protocol of all the things I'm going to do, and then that kind of emotional piece hit you later? Or were you able, with your background of being in therapy, were you able to kind of compartmentalize and say, okay, I'm going through this, I'm going to deal with it, I'm going through this, I'm going to deal with it?
I think, well, for me initially, it was just so overwhelming, all of the information that, lots of handouts and lots of this and lots of that, and doctors and radiologists and oncologists and surgeon and reconstruction surgeon. And it was really overwhelming. So I think initially it was just one foot in front of the other and just drinking from a fire hose of information. And so the first year for me was just get through the physical piece and just do what I needed to do. And then really once that final bell was rung and that year of Herceptin treatment, and I said, okay, now what? And for me, I was only HER2 positive, so that was it. And that's when the emotional piece really hit me personally, and saying, how do I keep it from coming back? And I was told, exercise, maintain a healthy weight, avoid alcohol, don't smoke. There was one more too, but they were all things I was doing when I got diagnosed. And so that really left me very unsettled. And so that was really a phase for me emotionally where I had to kind of wrestle with that fear of recurrence. And as far as the emotional piece, I gave myself permission to feel the feelings as I felt them. If I needed to have the really big, ugly cry with a puddle of tears and snot on the floor, and I am not kidding, I just did it. I just gave myself permission to feel it. And I didn't try to be Superwoman. I'm just like, I am feeling what I'm feeling. Let me have that feeling, and then let me move through it so I can get to the next place and look forward to things, and just recognize. I think, and also for me, I kind of developed this, once I realized how many women get this, it wasn't why me, it was, well, why not me? I think I've got a better chance of getting breast cancer than I do winning a scratch off lottery ticket, So just like, okay, so it's me, it's my number, do what I got to do.
Yeah, I think that's so empowering to hear, like, especially the women who are trying to be Wonder Woman. They're the moms, they're the worker, they're the wives, they're the ones who are like, I'm used to keeping everything together, and now all of a sudden I need to figure out how to keep it together for me. Just giving that permission and saying, like, no, you have to do that. You have to give that ugly cry its place, because it's going to manifest somewhere. So you might as well let yourself feel what you're feeling and allow it to come through. Because I do think, especially for, women who kind of are labeled strong, it's hard to kind of give into that. You sit there going like, well, this is a new feeling for me. And it's not always a welcomed feeling. So I think the listener now who needs to hear that, grab a Kleenex and have a good cry. I think that's going to unlock a lot at this stage in their journey. So thank you for that. And I have to say, she's a professional, so you got her permission to do it. Dr. Lynch, as everyone was talking, I was just thinking, even though this is such an isolating diagnosis at diagnosis, so, we've all seen, or I hope we've all seen I think it's the American Cancer Society commercial where it's like, the patient is in the clinic and the doctor says you have cancer, and then everything turns into like the Charlie Brown voice where you're not really hearing anything beyond that, because it was just like, you just hit me with something. It's such an isolating moment because you don't know what you don't know. But I feel like, I hope that the audience is so encouraged, because even though it may feel isolating in that moment, this can the cancer community, especially in breast cancer, I think probably more than in any other cancer, there are people ready and wait for what's next. Like in everything you will encounter, financially, emotionally, physically, everything, there are people in wait. So it's really just about making those connections. And I do think that for the most part, doctors are very clued in to the resources available, or you've got great support in your offices that you can say, go down and speak to so-and-so, and they'll connect you to the many, many resources. And now, of course, with social media, you do a Facebook search and all these private groups come up and it's like you just put in your information and all of a sudden you've got, you know, a sisterhood. But my real question, or my real kind of what I'm posing to you is, you know, maybe you can talk about where we are. So we've got this kind of like macro of all the support services available as an individual patient, but micro clinically, if you can talk to us about how this concept of multidisciplinary care has come to really own the cancer space, that this isn't even doctors making individual decisions. These are teams of doctors with you in mind that are making these decisions together. So maybe you can talk to us a little bit about that term multidisciplinary and then what it means to the patient with a diagnosis.
Sure, yeah, and that too has several layers to it as well. I would say when you think of the main physicians involved with the care of someone with breast cancer, you think of the surgeon, you know, who's going to operate and remove the tumor, and typically that's a breast surgeon. And then you have the medical oncologist, like I said, who does, you know, the treatment, either chemotherapies or endocrine therapies. Sometimes, once in a while, you know, in metastatic setting, we have some immunotherapies and different treatments. So they're going to provide that part of the care. And then you have a radiation oncologist who, if someone requires radiation after surgery, that's another main spoke in the three different modalities that we have. And so when you talk about multidisciplinary care, when you look at kind of making that main plan as far as, are we going to need chemotherapy first prior to surgery, or is surgery the next best step, first best step to make, and then is radiation going to be required? That requires, instead of just one person, you know, coming in, and you think of traditionally many years ago, I think most women presented to their surgeons and the surgeons just said, let's go ahead and do surgery, and then I'll get you to a medical oncologist, you know, if I think you need one, you know, and because there were some women who weren't referred, you know, who might have had discussions about risk reduction therapies. But nowadays, thankfully, with multidisciplinary care, those conversations happen right from the beginning. So, you know, and I think, you know, most large institutions that have, you know, breast cancer programs are going to have that multidisciplinary care from day one, where a woman may come in with a diagnosis and she may say she sees the breast surgeon first. There is going to be a conference that's held that has all of those individuals involved in that care. And so also, and so there, your breast surgeon may be discussing with the medical oncologist as to, do you think there's benefits in giving this patient treatment ahead of time? And sometimes it can have implications as to how we might treat, you know, a response to treatment that can be found by giving treatment ahead of time might impact what I may do after surgery. But if the breast surgeon, you know, took that patient straight to surgery, I'd never had that opportunity to have those discussions. So it's so important to have that whole team involved. And in addition to those are the doctors that you know, a patient might see face to face, but there's the doctors behind the scenes who are also very involved in their care. And that would be the pathologist. So, you know, the pathologist is reviewing things. Sometimes they'll point out things in a conference. So again, most places will have what's called like a multidisciplinary breast conference. And so that involves the pathologist as well, who's reviewing what they signed. And sometimes there's little minor things. So there's a lot you can get from the piece of paper, but when they're showing things on the screen and they might have a little bit more input, where I might say, you know, this cancer doesn't seem to be behaving as I would anticipate. Sometimes the pathologist comes up with some additional information that they're seeing that's helpful in the care of that patient. And then also the radiologist, so the doctor who reads the mammograms and the imaging, that's a very important part. Often there's heavy discussions between our breast surgeon and the radiologist who's reviewing the images, where they're asking questions, you know, if they're asking, is this something where we can spare the spin, you know, if someone needs a mastectomy and they're asking a question, can we spare the nipple? You know, they're looking at how far away is that. And so there's lots of robust discussion amongst all of those, you know, physicians who are involved in the care. And like I said, some of those who are behind the scenes where the patient may never meet, but actually those doctors are strong advocates for those women as well. And then additionally, at those multidisciplinary conferences, we'll have nurses, psychiatry, is often involved. The social workers are involved. Trying to think of other areas. Physical therapists, talking about lymphedema, all of those specialties, outside of, a physician specialty, there's all these other specialties that are so important to the care of that woman. And so when we have discussions about a patient, it's not only looking at just, what is the treatment for the breast cancer, it's kind of looking at what other resources might this patient need. There might be information that the patient has shared with one of our providers where we need to discuss that with physical therapy, or where we're reaching out to our social worker to say, this patient identified that this may be difficult for them, a certain aspect of their care, or their young kids, or how they're going to manage that. And that's another good time to be able to sit and really focus on that patient, but bring in all those specialties quickly to be involved in that patient's care.
Thank you. And Doc, there's so many patients now, especially with so much kind of, I don't want to say time on their hands, like, no one's doing anything through COVID, but there's so much more time for kind of self-education. And I think that there are a lot of patients, not that there weren't before, but I think that there are a lot of patients that are looking into alternative therapies or kind of boosters per se. So not necessarily, not chemo, but with chemo, can I? And, I had the pleasure of working, interviewing an integrative medicine doctor who just opened my eyes to so many things that even I, who've been in this space for so long, really kind of overlooked, or maybe just shrugged off, thinking like, I don't know that I would necessarily believe in that or something. So maybe you can kind of just talk for a minute or two about, for patients who may be not tolerating, the side effects from chemo, or who are in, remission, who have no evidence of disease, and who are, like Valerie saying, what else can I do? I am healthy. I don't smoke. I do exercise. I do have a good weight. I do have good mental, kind of hold on my disease and its process. Could an integrative medicine doctor provide additional information for patients like that, where they can safely incorporate some complementary and alternative strategies?
Mm-hmm. Yeah, it's true. There are definitely a lot of patients who are interested in looking at things beyond, kind of what you think of as far as traditional medicines. And I always have conversations with patients. I always say I'm a medical oncologist, so I'm a physician. The things that I'm going to recommend and do, it has to be evidence-based, and when you think of, all of the time and efforts that are involved in evaluating things through research trials. And I can understand why women, though, especially I think of women with advanced stage disease, who I just had a conversation with a patient this past week, and I said, I get it. I understand, like, these advancements can't happen fast enough for you. And I sure, I definitely can appreciate that. But at the same time, I have to say, the recommendations that I'm giving have to be based in evidence and proven. I can't say, I think this seems like it's a good idea, and so I think you should do it because it seems good. I have to be able to say, there's data to support the recommendations that I'm making. But at the same time, I do think there's a lot of things out there. There's a lot of information on supplements, and there's lots of patients who are using supplements. I remember many years ago, there was a study looking at women with breast cancer, and it was a huge number, I think at least 80%, who admitted that they use supplements and things like that along with their traditional medicines to deal with side effects of medicine, but also for other things to kind of try to boost their energy and that. So I do think there are things out there. And that's where I think, sometimes, like you mentioned, the integrative providers, can come into play. We have here at our centers, and, we have naturopathic physicians who often will oversee supplements. And I tell patients they're not going to be recommending something and saying, I think you should do this in place of what Dr. Lynch is recommending. Instead, they might say, for sure you need to do, what she's recommending as far as treatment, but here's some things that I might be able to recommend to assist with side effects of medications. You think of some simple things, but things that people aren't aware of. A lot of women will use ginger. I have some women who don't want to, really want to be minimalist on anti-nausea medicines and things like that. So women will use things like that. There is data, I think, of women, lots of women are on a drug called an aromatase inhibitor, which is an endocrine therapy. And one of the main side effects from that can be joint achiness or stiffness. There's very good data. There's studies out there that have looked at acupuncture for women who have joint achiness or stiffness related to that. And that's something our naturopaths here provide. I do tell women, again, for things like that, where that's been studied, I say if you're going to go and see someone who does acupuncture, make sure they're familiar with the studies and they're providing it or administering it in the manner in which it was studied. But there are things, I think, more and more that are coming available and more information that's available. Where it's helpful, I think, too, a big benefit of doing that through someone who is an integrated provider or even in collaboration with your medical oncologist is that to be aware of medications that we're giving for the treatment of the cancer. We would definitely not want patients to be taking things that might negatively interact. And so I know, thankfully here where we have the naturopath, that's something that they'll do. And sometimes it's looking over the list and saying, sorry, but we don't think you should take this right now because it could negatively interact. So I think you always want to be as safe as possible with supplements. I know a lot of times, and I understand why a lot of times medical oncologists, their first thought is just to say, I have no idea how that's going to interact. And so it's at your own risk. That is a scary place because I know a lot of women are interested in looking at these other supplements. And so going to someone who can kind of incorporate that, but they do, I think it's very important that they're a part of the team, that it's not just someone who's separate and recommending things independently without a knowledge of the treatments that their medical oncologists are providing.
Agree. And I think that that's a really strong takeaway that, wherever you're getting your information from, should be kind of in coordination with, or at least, continue to keep your doctor aware of the things you're doing. Colleen, I actually was going to go to you because, in my experience, so many times patients are expressing to the nurses, what they're doing, what they heard from their girlfriend did this, their experience with their side effects, or kind of exploring other ways to kind of boost or help themselves with treatment.
So I have to tell you about an interesting program we have at the University of Miami. It's actually a cancer support service. We actually have morning music meditation. We have gentle yoga with Valerie on Tuesdays. On Wednesday, we have 15 minutes of loving kindness. And we actually have a dog story, a virtual pet thing, all free, all available on Zoom. We still do wig consultations. Where's My Hair is the name of that program. Most of these are 15 to 30-minute programs. So we can't do things in person anymore, but we certainly have extended our support services. We have a harpist who plays on Thursday afternoon at 2. We have a meditation walk in nature. And you know how beautiful South Florida can be. So these are important for women who are trying to find something else to do. We're home with COVID. We can walk the dog so much. We can go outside and look at the birds. But sometimes it's nice to have these other alternative things.
Yeah.
And that's what a good cancer center, I'm sure Cancer Center America, University of Miami, the big research hospitals and facilities are able to do such that. And with the support of Susan B. Komen, Alison, I'm sure, and Valerie knows many of these types of programs that are available for our breast cancer survivors and the girls who are in the battle with metastatic disease. These are all important aspects that they should be looking into.
Yeah, no, definitely.
You went out of Zoom there for a minute, so I didn't hear the rest of the question. I hope that answered
It did.
what you were asking.
Thank you, Colleen. The joys of Zoom. I feel like we always have either someone on mute or someone who cuts out. Alison, as we kind of round out the program, I just wanted to ask you if you had, any kind of standout story on how advocacy has either touched your life or someone that you've worked with has kind of touched the life of someone else throughout their journey that you could share with us?
You know, when I saw that question from Courtney, I thought, oh my gosh, I don't know if I could tell you just one story. I thought, okay, I forgot about this, I forgot about that. But one that did come to my mind, and maybe it's because I interacted with him recently, is a person that I met actually through another person. You know how this is, you kind of meet people. And he runs what's called the Jared Kuhn's Pumpkin Run. And he runs it in honor of two people. One is his son, who died from leukemia. And then 6 years later, his wife died from breast cancer. So somehow we got connected. And somebody was just asking me this recently. I said, well, I kind of met him through a person. And so he funds, he supports my team. I support his pumpkin run. But, you know, here's a person who for 20 years now, he has had this big pumpkin run to support somebody else. He turned a very bad situation into a very great situation. And I'm thrilled because I get to connect with him and his daughter. That was her mother, obviously, that had died. And then she married a man and his mother had died from breast cancer. So it's those kind of stories to me that say, oh my gosh, you can make it through some very bad situations. And I think, as Colleen had said, there's some very strong people out there. So that was one that had really touched me. And probably a second one that has really maybe been on my mind is because a person that used to be a member of the Alison team, she just died this past year from breast cancer. Her breast cancer had metastasized. But I'm not kidding, 3 weeks before she really started going down, she had said, oh, I had another scan today. She was in all these treatment plans, trials, and she's giving back. She goes, if I can just keep this a little longer, they're going to learn more about my kind of breast cancer. And I thought, oh my gosh. So those are the kind of stories that say, we need to do our part, whatever we can, whether it's just a little note or a card to someone that's going through cancer, or it's fundraising. I mean, there's just the whole gamut, or taking somebody in a car that needs to go somewhere. These are the kind of things I think we can do to help support other people, because we don't know what their journey is that they're going through. And it can be touching, very inspirational.
And I think your story also, you know, even beyond Cancer Awareness Month, really kind of highlights the need to be kind to everyone. You know, you have no idea what people are going through, have gone through, where they are. And I think it's so important for us to kind of take a deep breath and a step back and say, is this argument worth it? Or is this comment going to be kind? Like, why would I? So I think, you know, as many times as you could kind of give love instead of anything else, you should. And I think October is it's a month that kind of says that all of us really are committed in what we're doing to make sure that that is what we're giving off. So thank you for those two stories. I think those are beautiful. And Valerie, I'm gonna ask you a question that I think is asked by a lot of people and is kind of always considered. And knowing that you're in this, you know, both as a patient and as a therapist, does your mental state affect outcomes? I mean, do you feel that being positive, that kind of being vulnerable, that having those good cries, that allowing yourself to feel when you need to feel, that all of those are vital parts of treatment and outcomes?
Yeah, I think that a person being really self-aware of where am I and how am I moving through this. I would hate to add pressure to a patient who's diagnosed with cancer and say, not only do you get to have cancer and go through everything you're going to go through, but you need to smile about it too. And I think that's such a disservice to women. And so for me, it's more about being aware of where are you? What are you feeling? Knowing that a feeling tends to be fairly temporary. It doesn't last unless we really pitch a tent and sit there. and really stew in it and dwell on it. And we don't need to do that. We can just feel it and move through. But I do think it's a great opportunity to really reevaluate some things in life. I know for me, it was definitely a realization of life isn't a guarantee. And if there are things I want to do, I need to do them. And so pretty quickly after treatment wrapped up, I made some decisions about things I wanted to pursue and accomplish and experience. And got a chance to do some of that before COVID. Thank goodness. COVID's put a little bit of a stop on it. Also taught me to set really good boundaries and to not spend my time doing things that really weren't very important, and to capture what is worth my effort, what is worth my time, and just having good boundaries around that.
Yeah, I think that that's such a beautiful way to put everything, that it isn't, it's like you said, it's not, here you go, here's cancer, oh, by the way, be positive because outcomes are better. It's like, you really do have to balance that and say many of the things that you said. And I think that that's, much of what you said is really gonna unlock, a lot of empowerment to people. And I mean, again, I just think beyond just this podcast and beyond October, how great is it to kind of come to the realization that life isn't guaranteed. There's no guarantee for how long we're here. And so I love how you said, if I'm going to do something, I need to do it. And that's true for all of us. I mean, in any way and in every way, that's true for all of us. So on that note, I always like to end our podcasts with kind of something lighthearted and silly. In honor of Breast Cancer Awareness Month, I'm going to kind of quickly go around the room. It should only be a sentence or two, but the answer is, and it's going to be asking you give me something on your bucket list. So Cynthia, I'm going to start with you. Give me something on your bucket list.
Okay, I guess I would just have to say I have at home, I love going to national parks. So on my bucket list, I would love to visit, let's see, I would say maybe at least 20. I don't think I can get to all of them, but I would love to visit at least 20 national parks.
Wow, amazing. When you go to the parks, do you kind of hike the parks and just, wow, incredible.
Yeah.
Very cool. Very cool. So that's an amazing bucket
We live
list.
in an amazing country, and I feel like, there's so many beautiful places, and so many of us just kind of grow up and stay where you're planted. But I mean, there's so much diversity across our nation. It's exciting to see different areas.
Absolutely. And that's a good COVID thing too. I mean, it's a car ride away. Even if, I'm in Florida and Dr. Lynch is in Arizona, it's a car ride away. I mean, get in the car, get the family together and check off the bucket list for at least a national park or two. So that's amazing. Colleen, I'm going to you. Something on Colleen Brennan's bucket list.
I had 12 days off a couple of weeks ago. So what am I going to do? So my daughter and I took a ride about 40 miles north, went to a riding academy and took a lesson on English horse riding. We had ridden Western our whole lives, and I never learned how to ride English. So I took a lesson, and I'm going back next week for another lesson. So I'm going to learn how to ride English during COVID. The horses don't have COVID, apparently.
Post pictures.
This is good.
Post pictures. That's amazing. Allison, how about you? Something on your bucket list?
Well, I love to travel, and I have traveled a lot of places, but of course, have kind of been stymied lately. Last April, I was supposed to go to Holland. I had planned a most perfect trip to see the tulips. It was just the perfect time. I was flying first class on points. So, that's an exception there. So I am hoping, I have it rescheduled again for the next April. Maybe it'll be the April after, but that's on my bucket list. I want to go to Holland and see the tulips.
Oh, gorgeous, gorgeous. Well, we're all going to be praying that you get to set up your bucket list. And Valerie, how about you? If there's something you're going to do, you need to do it. What's on your bucket list?
So all of those ideas were fantastic, and I'm taking note. My motto has been say yes, that when an opportunity comes up, say yes. and do it and try it and experience it. So it's really anything that comes my way that doesn't endanger my life. So say yes.
Oh, that's beautiful.
Good motto.
I read a book, I think it was Shonda Rhimes, that said like the year of yes, where she's a TV producer or writer. I can't remember what but she chronicled all these yeses and where it took her. So I think you're in good company, and I think fabulous things will continue to happen as you say yes. On that note, I'm so grateful that all of you said yes to this. You know, it's our little way of sharing an hour of time that's not election coverage, that's not COVID-19 stuff, that's not anything that none of us want to hear about anymore. And really just reach out and connect to people that are both in our circle and people that are joining our circles, either with a diagnosis themselves or as a caregiver of someone else. So I thank you all for everything you all do on a daily basis as part of your passion and mission in life. I feel honored myself to be able to sit in a seat where we can provide education, you know, to a great number of people through this time. And I thank you for being here. I thank you for what you do, what you will continue to do. I send you all of my prayers for good health as we continue to go through this crazy time. And keep doing what you're doing. If you ever need anything from us, we're always here. And I'm so honored to be able to count all of you as new jewels in my crown that I can reach out to when we're doing more and more and more. So thank you so much, and be well until we can see each other in person.
Thank
Thank
you,
you, Sarah.
Thank you.
Thanks
Bye.
so much.
Bye-bye.
Bye-bye.